Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Rania Nassar, Public Information Officer for the Harford County Health Department, and your host for today's Public Health Matters, the show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. Today's topic for Public Health Matters is lung cancer. We will be discussing this topic in order to raise awareness of the importance of keeping your lungs healthy and identifying local resources for those in need. Joining us today is Dr. Stewart, thoracic surgeon at the University of Maryland Upper Chesapeake Hospital, and Megan Kasem, nurse case manager of the Cancer Prevention Program at the Harford County Health Department. Welcome to our show, and thank you so much for being with me today.
Thanks for having us.
Great. If you guys don't mind, we would like to start off just taking a moment to introduce yourself and what your connection is with lung cancer. You'd like to go first, Dr. Stewart?
Sure. I'm Dr. Stewart. I'm one of the thoracic surgeons at the University of Maryland School of Medicine, part of the health system.
Mm-hmm.
So that includes University of Maryland as well as Upper Chesapeake here in our county. So I take care of all surgical diseases of the lungs, pretty much.
Oh, wow, that's awesome. And Megan?
Thank for having us, Rania.
Thank you.
I'm the nurse case manager for the Harford County Health Department Cancer Prevention Program, and we offer no-cost lung cancer screenings for eligible Maryland residents. So
That's awesome. Thank you.
Thank
you, ladies. So do you mind just telling me a little bit about what lung cancer is and why it's important to bring awareness to it?
So lung cancer is just the development of abnormal cells within the lung.
Mm-hmm.
And if those abnormal cells continue to grow and propagate, they can cause problems. And they can spread to different areas and, and if unchecked, can potentially cause you to lose your life. So that's what lung cancer is, just a bunch of abnormal cells that have grown and continue to grow and can eventually cause you to have some problems with your health.
Thank you. So what is lung cancer screening and what can a patient expect to go through when they do get a screening for lung cancer?
All right, so lung cancer screening is basically getting a CT scan of your chest, which allows us to see if there are any abnormal tissues within your lungs. It's a quick test. It takes only a few minutes for you to get. There's minimal amounts of radiation, but it allows us to be able to see if you have abnormal cells in your lungs sooner than later so that we could treat it, potentially cure you.
And I'm sure it's a procedure that doesn't even hurt. It's just a in and out type of thing. So
absolutely painless. You lay on a bed, you go through a little donut-shaped machine, and you come right back out. It's very quick, and we get your results, relatively within 24 hours. Typically, we can see the results and give you some answers about, if we see anything or if not.
Very quick, very easy, very painless.
Right.
yeah, so our program does a shared decision-making program meet up with the client in Upper Chesapeake. So
That's awesome.
yeah, they go over what the results were.
So who should be screened for lung cancer and what are the eligibility requirements for that?
So there is a certain set of guidelines. So you have to be within the ages of 50 to 80.
Okay.
You have to have what they call a 20-pack year smoking history. So did you smoke 1 pack a day for 20 years? Or did you smoke 2 packs a day for 10 years? So we calculate this pack year history. And then you have to either be currently smoking or quit within the last 15 years. And if you meet that criteria, you should be screened.
Okay. And then how about risk factors for lung cancer? Is this a history of families? What would be some of the risk factor examples for lung cancer?
The major risk factor for lung cancer is smoking.
Okay.
That's the number one.
Yeah.
But beyond that, there are some other risk factors. Yes, your family history. If you have a close family relative that had lung cancer, you are at slightly increased risk. There are other things such as radon, which is one of the bigger risks in the state of Maryland because we have a lot of radon. I mean, we're one of the states that has a good amount of radon in our soil.
Okay.
There are other kind of environmental exposures that you can have if you work with certain chemicals, asbestos. All those things can lead to a higher risk of developing cancer.
So we say, according to the CDC, about 90% of lung cancer cases are caused by cigarette smoking. As you said, that's the number one risk factor. And so the other 10%, again, that was the radon, environmental factors. Anything else too as well? Or is it really just the environmental
Those
factors?
are the type. I mean, environmental is like a big umbrella.
Okay.
You know, there are lots of things within the environment, and then there are some people that never smoke.
Okay.
That can have certain genetic changes that can cause you to be more likely to get cancer than the next person who doesn't smoke, which is unfortunate.
Yeah. So tobacco use causes harm to the whole body. That's, you know, nothing new. We've known that for so long. And it's not just the lungs that it affects. What other cancers can cigarette smoking cause?
So I think across the board we've decided cigarette smoking is bad.
Yeah.
Right? So it can cause effects to your heart. It can cause hardening of your blood vessels, which is why it can affect your heart. It can affect your blood vessels as they go down into your legs and your feet and can cause you to have something called neuropathy or problems with the blood flow to your extremities. It can have an increased risk of getting esophageal cancer if you smoke, head and neck cancers like your tongue, your throat.
Okay.
So smoking, although we know it's a big effect in lung cancer, there's, you know,
it's a
overall,
lot.
it's just, you know, it's not good.
Yeah, and I think it's really important to talk about that too, just because in Harford County, our adult smoking rates have always been higher than the Maryland rates. So I think, again, you know, just continuing that conversation about the harms that tobacco can cause, just continuing it, I think it's really important.
Yeah.
So we've talked about, you know, smoking cigarettes, but I want to kind of transition into talking about vaping and using, you know, electronic smoking devices, e-cigs, all that type of stuff. So can vaping cause lung cancer? And, you know, what other damages can using like a vape device or any type of electronic smoking device, what can that do to your lungs and to the body?
So as far as we know, vaping does not cause cancer. But vaping can cause you to have some problems with your lung. I always tell my patients that we were not meant to breathe anything but air.
Yeah.
You know, and you know, you can have worsening of your asthma if you're already an asthmatic. You can have, you know, you could get infections of your lung due to vaping. You could get fungal, you know, infections. You can get bacterial infections. And, you know, I also think the jury's still out. I don't think we completely know what else vaping can cause. But I would say I have quite a few patients that have used vaping as a bridge to get off of cigarettes. And I think that if that's all that we can do to stop smoking cigarettes, that's a great bridge with the expectation that you will also stop vaping. You know, so.
There's still so much out there that we still need to learn about vaping. We do know that it's not an alternative, but at the same time we know that it definitely can do some damage to the body.
Right.
It seems like it hasn't been around enough for a clinical study to be completed, so you just don't know.
Yeah, we're still learning.
Yeah.
So transitioning back to lung cancer, what are some signs and symptoms of lung cancer, and what should we be looking out for if we are at risk?
Yeah. So the largest symptom of lung cancer is no symptoms at all.
Oh, wow.
So
Okay.
the vast majority of my patients that come in, that were found to have a cancer on lung cancer screening, meaning early stage cancer, had no symptoms at all. And you know, I often get the, well, I feel just fine. I haven't been coughing or anything. And that's because lung cancer can be quite silent. And by the time it's not, it could be because you have pretty advanced disease by that point. Also, it depends on where the cancer is. So if the cancer is in an airway, you can have some coughing of blood. You can have coughing in general. If it's a large tumor, you can have shortness of breath. Some people develop pneumonias behind the cancer because the cancer will block an airway, and then you won't be able to clear your mucus, and so you'll get a pneumonia. And so sometimes people are find their cancer after getting workup for a pneumonia that just won't go away.
Oh, wow.
So the largest symptom is no symptom. But you know, you also see the common things that you see on TV, like coughing up blood. Whenever you watch a movie, it's like somebody coughs up blood and they're like, oh, you're like, oh, they have lung cancer. That's actually somewhat rare.
Oh, okay. So that's really interesting that you bring that up, because then it goes back to the point of it's really important to do that screening, that early screening, because if you really can't, you know, if you really don't have those signs and symptoms, then if we get that screening, we can see it through that CT scan, then we can act right away. So I think that's really important to get that out there, that, you know, you may not experience it, and that's why it's really important to get that screening in. I guess when you turn the age 50, I believe you said?
Age 50, you
age
got
50,
it right.
So, and you have those
if you're a pack a day smoker for at least 20 years, or 2 packs a day for 10 years or greater, you really should have the screening done.
Absolutely, because it can make a difference between a curable cancer and a cancer that we maybe would have a harder time curing or could not cure at all.
Okay. Is there anything that we can do to reduce our risk of lung cancer?
Beyond not smoking. So 1, not smoking. 2 is, you know, if you live with a smoker, because their secondhand smoke is also a risk factor. You want to, if you have a loved one that smokes in the car, maybe ask them to either not smoke in the car or put the windows down so that you can have a little bit more ventilation. But beyond that, you know, a lot of it is just, if you do get it, let's try to find it early and do lung cancer screening so we can.
I think with Harford County, the people should have radon detectors in their houses.
That's a good point.
That's a good
idea.
You know, especially with our county rates with radon, they really should be getting radon detectors.
Yeah, that's a good point.
That's something you can get at Home Depot.
That's something. That's a good idea. How about disparities? So do you guys know any disparities in lung cancer cases or deaths?
So lung cancer is the largest cause of cancer death in both women and men. Women are more likely to develop cancer cigarette for cigarette as compared to their male partners. So if you have a twin brother and you guys smoke the same amount every day, you as a woman are more likely to develop lung cancer than your twin brother, or you know what I mean, somebody who's a male who smokes the same amount. Women tend to have more genetic causes for their cancers. So I don't know if that's so much a disparity as much as an incidence is a little bit different. You know, the disparities in lung cancer identification and treatment are not much different than they are for, you know, healthcare across the board.
Okay, thank you. Can you guys talk a little bit about treatment options for lung cancer, and what are the next steps for someone who has been diagnosed?
So, you want to say what happens after you get your lung cancer screening?
Well, they have a shared decision-making appointment, and then they go over the results of the CAT scan, and then they offer treatment options based on what was seen. And in our program, we'll even catch like emphysema, COPD, and they're required to have CAT scans done, not required. To be in the program, it's encouraged to have repeat CAT scans every single year. So as far as other treatment post that.
So if we have a patient comes to our division that was found on CT scan to have what appears to be a lung cancer, you might come to me, you might come to an oncologist, you might come to a pulmonologist, but the next steps are to get a biopsy so that we can identify is that lesion on the lung truly a lung cancer? Is it another tumor of the lung that may be benign? After we've diagnosed that it's a lung cancer, depending on the stage, meaning is it only in the lung, which is an early stage?
Okay.
Does it look like it has spread to nearby lymph nodes, or has it spread outside of the lung? Those are all things that we need to determine initially. If it's an early stage cancer or a curable cancer, you may have surgery as your treatment.
Okay.
You may have chemotherapy as your treatment. You may have radiation as your treatment. Or you may have a mixture of all three.
Okay.
You may have two, chemotherapy and surgery. It really depends on the stage and the type of cancer that you have.
Okay.
And your overall health. So all those things are put into the decision-making process of what you will have as your treatment.
That's very interesting. So we're not really sure, kind of, everybody will be different, so it's kind of going to be done by a case-by-case decision, and with the doctor and the nurse, they'll discuss that with the patient.
Right.
How has COVID affected screening rates for lung cancer? How has it even affected lung cancer in general? Or has it?
Did you see a change in your screening rates?
Well, in 2019 and 2020, the state of Maryland's COVID or lung cancer screening has actually, the number of patients getting screened has increased per year.
Wow.
And then,
That's
during
great.
2019 and 2020, it stayed the same.
Okay.
So they didn't see the expected increase that they've been seeing over the years. So it kind of stalled the increase per year. So.
Yeah, I would say it's pretty steady in our experience. It kind of stayed the same in terms of the people that I saw that came to me after having lung cancer screening and finding a nodule in their lung.
Do you think COVID may have just heightened more people to go and search for not search, but get screened for lung cancer, kind of put it in the front of their heads, this is maybe something I should also get screened for? Or?
I think the results have to come out for 2022 and 2023 to be able, but there was a stall for 2019. So hopefully people are ramping up their health needs now that COVID seems to be a little bit quieter as far as affecting people. They're not getting as sick, so go back out there and get your cancer screenings done. There's nothing to be afraid of, so we missed those 2 years of getting your health where it should be, so. I think cancer screenings are really important right now.
Yeah, I think COVID in general kind of really got people to care more about their health, so they are going out, they are getting their screenings, they're getting their flu shots, the necessary prevention measures that they needed. So hopefully, out of that, that's something good that we were starting to see. Do you mind, Megan, just kind of talking a little bit about the lung cancer screening program at the health department and what services are offered?
So in general, our cancer program screens for colorectal, lung, breast, and cervical cancers. And we offer no-cost lung CAT scans for the lung cancer screenings. And we partner with the University of Maryland Upper Chesapeake Kaufman Cancer Center. And our clients have just raved about the program in general. The doctors, the nurse manager over there, they just are fabulous. And what they do is they'll have their CAT scan at advanced radiology, and then they'll have a shared decision-making appointment where they'll meet with the PA. They go over the results, and then our program will help link them for necessary, if there is something found, to help them find the help they need to continue their care. And the program encourages them to re-enroll every year. So if they have emphysema or a COPD or a small, suspicious nodule found, then they'll, you know, have this done every year. Is the nodule getting bigger? Is the emphysema getting worse? So it's a lung screening program, but it is actually healthy for your lungs in general. You know, you've smoked, let's see what's going on there. So it's a great program. Our program does take in anyone that's uninsured for our lung cancer screening program. So if you don't have insurance, you actually qualify for our program, or there's some other stipulations. So please call the program and ask if you're uninsured and you're interested in getting the your lungs looked at. Please, my clients love the University of Maryland Kaufman Cancer Center. It's been a really good partnership that we've had. We also, I just have to talk about the other programs.
Yes,
we
please
offer colonoscopies for insured and underinsured and uninsured clients in Maryland. So our program will do the colonoscopies at Hartford Gastroenterology Associates, and then we also offer breast and cervical cancer screenings, and that's also through the University of Maryland. So.
That's awesome.
Yes.
And then is there a certain number for people to call?
410-942-7930. And you can also find us on the
Harford County Health Department
Health
website.
Department
So go to the www.harfordcountyhealth.com. And if you go to our services, like I know that we can help guide people there, and you guys also have a form that people
we're
can
on Facebook, and there's a QR code that you can scan and fill out, and then you'll be referred to the nurse case manager for the different programs.
That's great. That's great. And then how about some resources for those who would like to quit smoking? What would be the best options for them?
So the University of Maryland Kaufman Cancer Center also offers a smoking cessation program. There's a QR code that can be scanned to get more information about that. And we also help with that with the health department as well. So you can call the number that I just gave for the health department for the cancer screening program to find more about the smoking cessation program, or you can scan the QR code that for the University of Maryland smoking cessation program.
That's great, and I know that the Maryland Department of Health does the awesome 1-800-QUIT-NOW.
Yes, yeah.
I mean, that is just an amazing service. I think that's offered to just Maryland residents and Harford County residents too as well. Just calling up somebody and help, just talking to someone and getting some help through this. I can't imagine. I know that tobacco smoking is so addicting. So kind of having that support and that care, I think, is so important.
Yeah, and oftentimes you need multiple different things to help you quit.
Okay.
You know, if you're unsuccessful with a patch alone, maybe a patch plus the quit line, or
a support. There's support that's out there, and it's non-judgmental. It's really important. I tell all of my patients that nobody's going to make you quit because you have to decide to quit. So there is no pressure. We just give you the resources when you're ready. And you really have to be ready. And when you are, we're here to help.
Right.
Yeah, and again, this is just the most important. This is definitely one of our top risk factors for cancer. So we really want to make sure we continue to spread that word of, all the amazing resources that we have in the state to help people to quit smoking. It's definitely probably one of the hardest things. It's an addiction, and I think we have a lot of support out there.
Yeah.
So that'll be good. Is there anything else that you ladies would like to add about whether lung cancer, tobacco smoking, cancer screenings in general?
I can't impress enough the necessity to do lung cancer screening. It makes a big difference in having a curable lung cancer and not having a curable lung cancer. So if you are a smoker, and you fit that criteria, again, 50 to 80 years old, have been smoking within the last 15 years in a 20-pack year history, please consider getting screening.
Yeah.
It actually has it saves lives.
Yeah. It's really important.
It really does.
Thank you.
Yeah, I think most cancers are silent.
Yeah.
That's why it's so important to get cancer screenings, and they're available at no cost. So why not take, advantage of these resources and take care of yourself, because, it's important.
Yeah. I don't know, my hope would be that at some point this cancer screening ends up being like mammograms and colonoscopies, where people just get them done. We're not quite there yet, but hopefully we will be soon.
Hopefully, well, we're starting that conversation today, so thank you, ladies. Well, that's all the time we have for today. I'd like to thank my guests on today's show, Dr. Stewart and Megan Kasem. If you'd like more information on lung cancer, please refer to the resources page after the show. And join us next time for another important health issue that matters the most to the citizens of Harford County. Thank you for watching.
You've been watching Public Health Matters, brought to you by Harford TV. Watch what matters.